This conference will now be recorded.
Hello students, I'm Dr. Divya from TeenEinstein. So this is the sixth part of chapter number 13, Why Do We Fall Ill? And in this chapter, we are learning about health and its failure. So what is a healthy condition and how the health is getting disturbed. Then diseases. If it is getting disturbed, that is called as a diseased condition. And what are the causes of that diseases? Then infectious diseases. We are learning all about these things. So we have already learned about a healthy condition, what is health and how it is getting disturbed. And if the health is getting disturbed, that is called as a diseased condition. Then we have learned that diseases and the causes of different diseases. Then diseases are of different types like acute and chronic, right? And how this chronic situations, chronic conditions are appearing and what is the cause of that. So chronic disease and poor health. What is the relation between these two? Then we have learned about different causes of diseases. And diseases that may be infectious diseases means there will be a microorganism which is causing for that disease. And non-infectious diseases means which will not, that microorganism will not spread from one person to another person. So it won't get transmitted. So diseases, different causes of diseases, we have already learned infectious and non-infectious causes. That also we have discussed in that whether all diseases are spreading to people coming in contact with a sick person, that we have discussed. Then what are the diseases that are not spreading and why it is not spreading? So how a person develop those diseases that don't spread by contact with a sick person? That means the non-infectious diseases, how those are getting spreaded from one person or how it is getting transmitted from one person to another person, and what are all the reasons for that. So those things we have discussed. Then about few infectious diseases like SARS, then Staphylococci, trypanosoma, leishmania, then about a roundworm, all those things we have discussed. Then how these diseases are spreading. Different means of spreading of these diseases, that also we had discussed. So there may be through direct contact, some diseases may spread, and through air, and by indirect contact, that means from an infected person, by indirect contact, by food, then by some vectors. So everything, it is getting transmitted to a healthy person. So common methods of transmission of diseases also we had discussed. Transmission of diseases, that also we had discussed, right? So next we are going to learn about organ specific and tissue specific manifestations. Organ specific and tissue specific manifestations. See, we have learned that diseases are spreading because they are caused by some microorganisms. So the disease causing microorganism. Disease causing microorganism. How that microorganism enters the body. How it is entering inside the body. So how a disease causing microorganism or microbe enter the body? So that will enter through different means, right? So we have learned different means of spreading, or through it may go through air, or by air, or by direct contact or indirect contact. So different modes are there for entering. Entering inside a host body, right? Then after entering, where it will go? Where this microbes will go? After entering inside the body, how these microbes are going and where these microbes are going. Actually, we know that our body, that is very large compared to the microbes. Microbes are minute organisms, or very small sized organisms. That's why we are calling as micro, very little sized organism, microorganisms. Right? So these organisms are very, very small or very minute compared to the large body. Isn't it? So there are many possible places, right? Different organs are there, different tissues are there, different cells are there where it can go. Next question is, do all microbes go to the same tissue or to same organ, or they are going to different places? See, they are very minute organisms, so they're having many chances or many places to go inside our body, right? So whether they are, after entering into our body, whether they are going to the same place or to different organs or different cells or different tissues, they are going. Okay. So we know that microorganisms or this microbes, they are of different types, right? So all the organisms, all the microbes cannot grow in the same place, right? Because they have evolved in such a way that they can live in particular parts of the body, right? So different organisms need different conditions to grow, right? Some organisms cannot survive in the intestine, right, in our stomach or in our intestine, because there so many enzymes are there, and there the condition of the digestive system, that will be different compared to lungs. So some organism will be growing inside lungs because that will get adjusted to that condition, and some will be in our intestine, those can withstand that enzymatic activity and the pH which is present in our stomach. So such conditions, depending upon the conditions, in which that can survive, that organism can survive, according to that, in different parts of our body, it will grow. Okay. So, like in part, we can say they are selecting, or their selection is connected to their point of entry. Selection. The selection is connected to their point of entry. Their point of entry, right? See, if they are entering from the air, if they are airborne diseases, or microorganism can cause some airborne diseases. So such microorganisms which are entering through air, if their entry is through air, where it will go? Usually, while breathing, it will enter inside. So it will go via nose, right? So where it will reach? There are chances to go to the lungs, right? Compared to other places, they will go to lungs, right? So this is happening in the case of those bacteria which is causing tuberculosis. Okay, so that's what happening when the bacteria which is causing tuberculosis, if they enter through mouth, they can stay in the gut or gut lining. Okay, if they are entering via nose, they'll go to lungs. Okay, and there is a chance of tuberculosis. And if they're entering through mouth, what will happen? They will go to gut lining. They'll grow there. Okay, and they'll grow like a typhoid causing bacteria. Then what will happen? They will grow like typhoid causing bacteria. Okay, then they can go to liver also. So if they are going to liver, like viruses which can cause jaundice, they'll grow up like viruses. Liver means they'll grow up like the bacteria which can cause jaundice. Clear? So how they are entering, or through which part they are entering inside the body, they will cause such type of diseases. So microorganisms, they are of different types and they are growing up in different conditions, right? So their selection, that is connected to the point of entry. If they are going through or by air, means it will enter through nose. Via nose it will enter and it will go to lungs. If it is going to lungs, that will grow up like a tuberculosis causing this organism. Okay, tuberculosis causing organism. If entering through mouth means there is a chance of going to gut lining, then it will grow like typhoid causing bacteria, right? Or if they're going to liver, the virus which is causing jaundice. Okay, but this won't happen in all the cases, right? So what will happen? Like infection, like HIV. So HIV infection, which is happening through the close physical contact. So always this won't happen. In such cases, if you're talking about infections like HIV, this HIV, we know that it's through close physical contact, right? So there a close physical contact should happen. So an infection like HIV comes into body through close physical contacts, right? So through such close physical contact and through those organs, through sexual organs, that will spread to lymph nodes all over the body. Clear? Spread to lymph nodes and then to reach all over the body, right? Then some organism which is causing malaria. Malaria causing organisms or microbes, they will enter to the body through mosquito bite, right? So mosquito bite means female mosquitoes, those will bite and through that it is entering. Then where it will go? Those organisms, those microbes will go to those microbes will go to liver, right? And then from liver to red blood cells or RBCs. Then in other case like a virus which is causing brain fever. The virus which is causing Japanese encephalitis or brain fever, that will also enter through mosquito bite. This is also through mosquito bite. But it is not going to liver. Where it will go? It will go and infect the brain. Their brain infection. That is happening. Okay. So here, malaria, that is also through mosquito bite. Then that microbe will go to, or that microorganism, or that infection causing microorganism will go to liver, and from there it will go to RBC, or red blood cells. Okay. And here, Japanese encephalitis or brain fever, that is caused by virus, that is also spreading through mosquito bite. But it is going and infecting brain. It is causing brain infection. Okay. Then whatever may be, if the body is getting infected, any part of body is getting infected, there, based on the symptoms of a disease, we can decide which infection is there. Based on symptoms, we can make out the disease, right? But the symptoms will appear based on which tissue or which organ if the microbe is targeting. Which organ or tissue is infected, based on that symptoms will develop. So symptoms will develop based on the depending or the target organ where it is getting infected. Based on that organ you will get, or the symptoms will develop. So if lungs is getting infected, lungs means, or if lungs, they are the target organs, means the symptoms will be cough, right? If lung is getting infected, what will happen? Breathing issues will be there. So breathlessness, breathing issue will come, cough. So such things will happen if lungs are the target organ or lungs are getting infected. The symptoms will be like this. If liver is the target organ or liver is getting infected, what will happen? Jaundice. It may cause jaundice, right? And if brain is the target, brain is getting infected, we can observe some kind of headache, then fits, vomiting, then unconsciousness is getting infected. If brain is having some kind of disturbances due to some infection or some other disturbances brain is having, means what will happen? First headache will come, right? See, if you are just imagine, just think like if you are watching movie whole night, we are sitting and watching movie. That's a overload for our brain, right? Next day, almost every people will get without rest. You are not sleeping after that. Sleeping means that is giving a rest for our brain, right? Half of the task will get stopped there, right? If you're sleeping, our eyes should not work, right? It's not working. So that workload is getting reduced there. And if you're sleeping, there is no other like light management, you are not watching anything and completely you're taking rest, right? Your body is not moving, like always you're sleeping. So the other works like giving signals for your digestion and other body works, other body organs and organ systems which are full time working, only that should get controlled by the brain, right? Brain signals will work only for that. When you are sleeping, that is a rest for your brain. Half of the workload is getting reduced. That's why we need to take rest. We need to give rest to our body. So continuously without any rest you're working or you're watching movie, in that cases, definitely your brain will get disturbed without any rest, right? So in that case also you'll get headache and vomiting sensation will come. So such things may happen. So if your brain is getting infected by other microorganisms, what will happen? That is a kind of disturbance for the healthy condition of your brain, right? So headache will develop. So symptoms, by these symptoms we can make up like headache, then fits, vomiting, and unconscious conditions that may come, right? And we can imagine just all these symptoms and the signs of an infection, symptoms or signs we can tell. All these symptoms or signs, they are indicating, they are just giving indication that which part is getting infected. Right? So that kind of infections, by making or by pointing out all these symptoms, we can make out which is the target organ. Okay, we can make out that, or we can understand that which is the target organ or target tissue which is getting infected. Okay, and same time you can notice that if there is a target organ or target tissue, all other work by this target organ will get disturbed. That also will get disturbed slowly, right? See, in addition to these tissue specific effects of this infectious diseases, there will be common effects also, right? See, most of the common effects that are depending upon the fact that body's immune system that is activated in response to the infection. Okay, see, in everybody's body, immune system is working. See, up to a level, this immune system will work to prevent that infection. So immune system will get activated in response to that infection. Immune system that will get activated as a response to infection, right? So an active immune system that is asking many cells to do the response, right? Our immune system will get activated when our body is getting any kind of infection. So what our immune system will do? See, if our country is getting attacked by any other external people, so what will happen? We'll ask our defense people to defend against that, right? In the same way, in our body, when we are getting an external infection or when we are getting any microbial infection in our body, any microbes are coming from outside, our body will respond, because our body, how that response body will show, the immune system recruits many cells to the affected tissue to kill off that disease causing microorganism. Okay, see, our lung is getting infected, there more cells will get activated to work against that infection, okay, to kill that microbe which is entered inside the lungs. Okay, it will try, our body will try the maximum level to prevent or to protect from that, to kill that microorganism which is entered inside the body. So that is called as, that recruitment process, that is called as, more cells will get activated, what, to kill the microbes, right? So that recruitment process, that is called as inflammation. Okay, so that is called as inflammation. So as a part of that inflammation, there are local effects. Okay, so when more cells are getting participated in that defending process to kill that microbe, or to prevent the entry of that microbe or the infection, to prevent that infection, more cells will try, right? Our body will try from their side, maximum level of trial will take place, right? So that recruitment process or that participating process of more number of cells, that is called as inflammation. So as a part of that inflammation, some local effects we can see, that inflammation may cause local effects. Local effects in the sense we can see some swelling, pain, fever, pain, swelling and all as a part of this inflammation. Okay, that's why we are saying this fever is not a disease. It's like some external microbes or some external source is coming, that is without the body's permission, it is coming inside our body, means our body will try to prevent that entry, or our body will fight against that microorganism. So for that purpose, first body will increase the temperature to prevent that. Okay, so that is just like activation of the immune system. Our immune system is getting activated as a response of that infection. To respond towards that infection, our immune system is working. It is working more. So more cells are getting participated in that, or more cells are getting recruited for that process to kill that microbe. So that is called as inflammation. And as a part of that inflammation, you can see local effects. Some local effects also you can see, like fever, swelling, pain, and all. Okay. And in some cases, like if there is a HIV infection, the virus, HIV, we know that is a viral infection. So what will happen? This virus will directly go to the immune system. Virus goes to immune system. Okay. And that damages the function of that immune system. Usually what will happen? Against the microbial entry, our immune system will work. Our immune system will work against that, and it will try their maximum to prevent the infection or to fight against that infection. But in the case of HIV infection, happen, that virus will directly attack the immune system, and that immune system is getting damaged there. That damages the immune system itself. Okay, so body don't have any defending mechanism against that. So the body don't have any, already it is damaging the immune system. So there is no option for defending, right? Body don't have any other option. Already we have our immune system, and that immune system itself got damaged by the viral attack. So what will happen? There is no option for body to defend against that organism. So what there, in that cases, many of the effects of HIV AIDS are because of the body can no longer fight for that. Okay, so many minor infections also they'll face every day, because already the whole immune system got damaged. So body don't have any other option to defend against the microbial attack. Even that's why whole immune system is getting damaged, and the body don't have any more capacity to fight against to the minor infections also. So every day they will face one or the other minor infections. Okay, so in such people, even simple cold that may lead to pneumonia. Okay, because their immune system is completely damaged. And a simple minor gut infection that can produce major diarrhea, and blood loss also will happen. Ultimately, these people, those who are suffering from this HIV, or those who are having infections, that HIV infected people, those people's immune system is completely damaged. So every day one or the other minor issues will develop in them, and their whole immune system will get damaged, and they cannot survive. A condition will develop like they cannot survive anymore. In that condition, that kills the people suffering from HIV. Okay, so that's how the death of these people happens. Okay, so what is happening in the case of this HIV? HIV means human immunovirus. That AIDS means Acquired, see, AIDS, what is the full form of AIDS? From there itself, we will get the nature of the disease. Acquired immunodeficiency syndrome. Immunodeficiency, their immunodeficiency is developing. Okay, so that is the syndrome or disease which is having immunodeficiency. They don't have the ability to withstand against the microorganisms or the infections. Immunity is deficient in that people, and that is acquired. Okay, due to the viral infection, this immunodeficiency is happening, or immunity is completely getting damaged. Immune system is getting damaged. So while getting disturbed by these viral attacks, that immune system is getting damaged. And if the immune system is getting damaged, our body doesn't have any other option to fight against the infections. Even though it is a major or minor infection, whatever it may be, our immune system is damaged. After it is getting damaged, our body won't be having any other option to fight against even the minor infections. So what will happen if a simple cold is coming? That also will lead to pneumonia. Serious lung infection will come. And if any simple gut infection is coming, or any simple uh, gut infection or minor gut infection is coming, means that will create diarrhea, that serious diarrhea with blood loss. Okay, blood loss will happen along with the stool. So that their health will get completely damaged. So they won't be having, or they won't be having the ability to withstand against these minor infections or simple health issues also. So finally that will lead to death. Okay, so that's why AIDS is killing people. Okay, that ultimately it is becoming the reason for the death. Clear? Then, see the severity. A disease we will tell that is in severe condition. How we can tell that? That depends upon the number of microbes in the body. If the number of microbes, severity depends upon number of microbes in body, right? If there is a simple infection, we know that very less number or very small number of organisms, microbes are inside our body. So they can be monitored and they can be controlled, right? If the number of microbe is very small, the disease manifestation may be minor. Okay, it will go unnoticed. Right? But if the number of microbes less, means that will be simple infection, or we can say it's okay. If large number of microbes are present inside the body, or we got a serious infection or infection happened inside the body, then what will happen? That disease can be severe enough, and that can threaten the life also. So that will be life threatening disease. Okay, that may lead to that condition also. So the immune system is a major factor which determines the number of microbes surviving in the body. Okay, if our immune system is in a good condition, that will not allow. So immune system, the condition of our immune system, that depends. Okay, so immune system, depending upon the condition of the immune system, this microbial entry may lead to a major infection, or if our immune system is good enough to control the microbial entry, means that will be a simple or minor infection, right? So the immune system is a major factor which determines the number of microbes which can survive inside the body, right? Then see, if infection happen, definitely we'll take treatment. So there are some principles of treatment. Principles of treatment. See, if it is a major or minor infection, whatever maybe, we need to take treatment. So, what are the steps taken by our family when we are falling? Right. Sometimes we'll feel like if it is a minor infection or minor body disturbance, we'll think like, okay, we'll take rest. We'll sleep for some time, then it will be better. So when some treatment, we are taking rest for 1 day or 2 days, we are taking rest, then also it's not able to control, still we are feeling like we are so tired and we can't do any work, then we'll approach a physician. First, we need to give rest to our body, right? Next step is approaching a physician, right? So when we need medicine, when we need to take medicine, so so far that infectious disease which will appear, it would appear that there are two ways to treat the infectious disease. One would be reducing the effect of disease, and other way is to kill the causes of disease, right? Reduce the effect of the disease. And the second way which we can do is kill the cause of the disease. Right? These are the two ways which we can take. So for the first one, to reduce the effect of disease, we can provide treatment which is reducing the symptoms. We can provide treatment which is reducing the symptoms. And the symptoms, usually we said symptoms means they are the inflammations, right? For example, we can take medicine to bring down fever, to reduce the pain, or to reduce the diarrhea. We can take medicines, right? So we can take rest also, so that we can keep our energy, right? So that will help us to have more focus on this healing purpose, right? So such treatment like taking rest and storing energy, like that, so direct treatment, this kind of symptoms directed treatment, sometimes it won't make the infected microbes go away from the body, right? So after taking rest also, that symptoms may persist, or that microbial infection will be there. So for that one, we need to do, then we need to kill the microorganism, or we need to kill the causes of that disease. So how we need to kill the microorganism? One way is using medicines, right? So we can use the medicines to kill that microorganism. See, we have seen that microorganisms can be classified into different types like virus, bacteria, fungi, or protozoa. So each group of organism will have some biochemical life processes which is particular to that group, right? See, infection is happening. So first method is taking rest. Okay, then also no use. It's not or symptom. After that also symptoms persist. Next, second method is killing the cause. That means killing the microorganism, killing microbes by medicine. So how we will decide which medicine is to be used? See, we know that microbes or that infections are of different types. Viral infection may be bacterial, fungal, protozoan. So different types of infections will be there. So each group, whatever it may be, it is having its own biochemical process. Right? It's having viral infection or bacterial infection, fungal infection or protozoan infection, whatever it may be. Each organism will be having its own method of living, its own biochemical processes for the life. Right? That is peculiar, or one particular group will be having its own method of living. Right? And that will not be sharing with the other organism. See, viral method won't be similar to bacterial method or fungal method, right? So that pathway we need to find out. That is a pathway which is followed by the virus, or this is a pathway which is followed by the bacteria. So like that, we should have a knowledge. So these processes should get blocked. Okay, so our cells, for example, we can say our cell may make new substance by a mechanism which is different from that used by bacteria. So we have to find out. So what we will do, that pathway which is followed by this viral or bacterial, whichever infection we have, that pathway we need to find out, and that should get blocked, right? So our body, we have to find out a drug which is blocking the bacterial synthesis. See, suppose we are finding out that is a bacterial infection, then that drug should be able to block bacterial synthesis, or that biosynthetic pathway which is helping that bacteria to multiply, that should get blocked, right? And at the same time, our body should not get affected because of that drug. That drug should not affect our body, right? That's what we need to do. That infected microorganisms multiplication should get blocked. At the same time, it should not affect our body. Okay, so that is what we are doing by the use of antibiotics. Okay, so that's what we are achieving by the antibiotic usage, and now we all are familiar with that. Okay, and to kill protozoa, we have say medicine type. And one reason why making antiviral medicine is harder, we said virus, they are just a genetic material. When we are when that is entering to the host body, it will start working. So this antibiotics, we said it won't work for viral infection, right? That's what the one and only reason which is making difficult this antiviral medicine. Okay, antibacterial medicine making is easy, but in the same way antiviral medicine won't work. So when they are entering into our cell, I said, when a virus, see, bacterial antibacterial medicines are easy, and viral, when the viral particle is entering inside the body, that is using our body, or our body machinery is used by the viral organism for the life process of that. That means there are comparatively we have a few viral specific targets to kill that virus. Okay, so there is a limitation. See here, our drug we can make which is killing the whole bacteria and their multiplication and their biosynthetic pathway. But here virus means that is just a genetic material, and when it is entering to the host cell, it is becoming a part of that cell, and the whole cell pathways it is using, and it is getting multiplied along with the cell machinery. So we can't, if we can't target the whole cell, we can't kill the whole cell to kill that viral organism, right? So there are few effective antiviral drugs. See, for example, drugs which is keeping the HIV infection under control. Under control. So medicines, few medicines are there, developed medicines are there which are keeping these infection under control. Okay, so because the viral genetic material, it's becoming the part of the host cell. So we can't target from all the aspects, we can't target only the viral genetic material. If you're killing, that may affect the cell of the host organism also. That's why there is a limitation in killing this viral entry or viral organism which is entered inside host body. But few medicines are developed which can keep this viral infection like HIV infection under control. So these are the principles of treatment. We need to find out the cause first, and we need to take necessary action. Our body itself will take first step, and in the case of some infections like HIV or viral infection, something like that, which is first of all, it is damaging the immune system. So our body immune system is getting damaged. So there is no other thing to protect us, right? So that time we need to go for medicines, right? Some drugs we need to find out, and first we need to find out the cause which microbe has entered. Then, if it is a viral, bacterial, fungal, or protozoan, first we need to find out which is the cause. Then we need to block the pathways, biochemical process, that pathway we need to block. So for that, we need to use medicines. So bacterial infection means drugs are there, antibiotics are there, which can affect, which can stop the biochemical pathway or biochemical synthesis of that organism, microbe. And at the same time, it will not affect the body of the host organism. So that's what antibiotics are doing. Okay, but in the case of viruses, that is difficult. Okay, so in this class, what and all we have learned? See, like diseases may be due to infectious or non-infectious causes, and infectious agents which is belonging to different categories of organism, and that may be unicellular organism or microscopic or multicellular, right? So the category to which a disease causing organism belongs to, that decides the type of treatment. So these infectious agents, they can spread through air, they can spread through water, through physical contact, or through vectors it can spread. So prevention of this disease, that is more desirable, because the treatment may be successful or may not be. So first we need to prevent. Okay, so all these things in next class we'll be learning about the principles of prevention. For prevention, what and all we need to do to prevent this disease. So prevention, always we used to say that there is a saying like prevention is better than cure. After getting infected, taking treatment is difficult. So before that, we can try our maximum to prevent this kind of diseases. So everything we know that generally we can say that hygiene, maintaining the hygienic condition, that is very important to prevent almost all the disease. Okay, so in the next class we'll be learning about principles of prevention. Thank you.